Good morning, tech people. My name is Brian Levine. I'm with the Maryland Tech Council. Here's a 30-second warning, and we'll begin, and I'll introduce our speaker for the morning, Josh Silverman. All right, good morning, everyone, and welcome to the second day of Maryland Tech Council's Digital Transformation Virtual Summit. I am Brian Levine. I'm Vice President of Technology and Innovation for the Maryland Tech Council. We have a great day of programming ahead and an impressive lineup of speakers who are excited to bring you relevant and timely content. Kicking off things today for us is Josh Silverman. He is Senior Vice President of Transformation at Versant Health. Josh will be reflecting on Versant Health's transformation journey over the last 3 years. He is responsible for leading enterprise-wide change management efforts, serving as a central advisor and strategic partner to the Chief Executive Officer, and taking forward the organization's integration and transformation agenda. With over 20 years of healthcare experience with companies such as United Healthcare, CVS Caremark, and now Versant Health, he has proven to strategically foster innovation along the business and technology transformation journey, which is what we're talking about today. Before I hand it over to Josh, I encourage you to utilize the chat and Q&A features located at the bottom of your screen during the session. And you can use these features to make comments or ask questions. You know the drill. I will be monitoring the chat and the Q&A during the discussion, and we'll ask questions of Josh when he's done with his presentation. So without further ado, I would like to introduce you to Josh Silverman. Josh, thank you for joining us today, and take it away.
Thank you, Brian, and thank the Maryland Tech Council as well, and thank everybody for joining today on this hopefully start of the spring here in Maryland. So today I'm going to be talking about the Versant Health digital transformation journey, and really it is not just digital transformation. It really began with the business transformation over the last several years. And again, thank you, Brian, for the introduction, so I didn't have to talk about myself and my credentials. I appreciate that. First, I wanted to give you a little background about Versant Health and who we are, the industry that we're in, the space or the niche that we are within that industry, as well as kind of some history on Versant Health, just to give a little background and context on our journey. Versant Health is made up of Block Vision and Davis Vision and Superior Vision, and overall we represent about 37 million members coast to coast. In doing so, we serve all the different markets. When I say different markets, I mean commercial members, third-party members, Medicare Advantage and Medicaid members, and also we serve a unique space in the vision eye care space, which is the medical surgical members. So we also, not only do we handle the eye exams, routine eye exams, and eyewear, we also handle pretty complex medical and surgical procedures, serving the networks as well as claims payment and TPA services. So here's some stats about kind of how we break out, where we're represented, throughout the country, and where we have our offices throughout the country. Again, you know, what we do at Versant Health goes beyond just basic services, a very complex set of offerings that we have. A brief history about Versant Health. I don't want to spend too much time on this, but wanted to give a little context of the changes and alterations of the business models as we've gone in history. Versant Health actually started back in 1917, Davis Optical, as part of an optical shop, believe it or not, in New York City, converted over to an insurance company in 1964. In 1990, separately, Superior Vision began serving employer groups throughout the country. And really, that's where Superior started in earnest. In 1994, Block Vision, which was another smaller vision insurance company, began servicing government-focused sponsored plans, again, Medicare, Medicaid plans. In 2013, when I joined the organization, Superior Vision merged with Block Vision and became the 5th largest vision company in the vision space, servicing both commercial and government programs. At that time, Nautic Partners, which is a private equity firm, purchased the organizations and brought them together. In 2017, we'll just jump to there, Superior Vision and Davis Vision came together. They were sold to Centerbridge Partners, which is another private equity firm, and really became Versant Health. That's when I was given the role of transformation lead and really driving the business changes and integration of the two companies. In 2018 is really where we began the journey in earnest of our transformation, and really focused on about a portfolio of about 16 projects focused at both growth as well as operational excellence, focused really on the end user and how we are delivering our services and goods to our members and other constituents. In 2020, late 2020, Versant Health was actually acquired by global group insurance company MetLife, in which we are today a wholly owned subsidiary of MetLife, separated and firewalled, but however servicing the MetLife in the future MetLife population as far as their routine vision insurance. Another unique aspect about Versant Health, and again, just more context to the complexity of who we are in the industry and kind of which led to some of the changes that we made, was that we are part of the supply chain. We own an optical laboratory that fabricates lenses, cuts lenses, puts them into frames, and sends them out to our provider network to service the members. We have a laboratory in Newtown Square, Pennsylvania. We produce about 1 million jobs or pairs per year to our Medicaid population. We also have a partner labs throughout the country, over 74 partner labs as part of our relationship with Essilor Laboratories of America, in which our providers can select those laboratories and choose which type of jobs to send to those laboratories. This is important context as we talk a little later on some of the changes that we made and really understanding the complexity of the industry. We also took an approach where we wanted operational excellence at our laboratory, and we are one of a handful of 3 labs within the country that are ISO 9001 certified, meaning that we have the highest quality standards. We're testing those standards often, and we are certified every few years. And what also differentiates our laboratory is our investment in our laboratory. So we are constantly making sure we have the latest equipment and upgrading that equipment on a consistent basis. As we look at the vision industry and we look at where we fit in, we are really at the center. At Versant Health, we are at the center of the ecosystem. Really, when you take a look at the left, it starts with the member. Members are either employees that purchase their insurance through their employers, or the employer sponsors the program, or like I said before, the government programs such as Medicare or Medicaid. Most of routine vision is supplemental to Medicare. However, sometimes plans embed that as part of their offerings. There are intermediaries that sell basically vision, and those are brokers and benefit consultants. And really, we work with those folks typically on the employer space to offer our products to employers. So really complex kind of start of the chain. As kind of we fit in the middle, what we do as a third-party administrator is that we service the network. We build a network. We service the network. We offer, we pay the claims. We offer authorization reviews, and we administer the programs in totality. We do ID cards. We send out correspondence, et cetera, and we promote the programs for the employers. We also serve what are known as third parties as well, and those are large health plans. So we either private label or forward-facing branded products for third parties as well, and just a couple of those: Blue Cross Blue Shield, Cigna, and Aetna. For the government space, 99% of that business is through third parties and through either Medicare or Medicaid plans offered throughout the country. So each state is different in their offering for Medicaid, and each state has different parameters and ways to operate. So it is quite complex, the ability to adjust from state to state. So really, when you look at your systems and the need for being agile in those systems, it's important that you have that flexibility to make those changes fairly quickly. As we all know, probably on this call, that there are changes happening rapidly within government. On the right side, again, we service our members through our provider network, and our provider network consists of independent optometrists and ophthalmologists, as well as opticians that service the material components of our programs. When I say material components, I mean the eyeglass lenses, the frames, as well as contact lenses that we offer. There's also national retail chains, and these include the large ones like Lens Crafters, Walmart, Costco, VisionWorks, and America's Best, just to name a few. We have regional retail chains as well in our network, but we have over 110,000 access points throughout the country within our network. Again, variations show up when you talk about what contracts people are under, how they get paid, and complexities of product offerings that they have at their locations. In order to service the members as far as the eyewear component, so the professional component is handled through our doctors and retailers. Then the material is then ordered, and they are fabricated, as I mentioned before, through laboratories and laboratory systems. And again, we own a piece of that in the supply chain, and our lab in Newtown Square, Pennsylvania, services the Medicaid population, where our partner Essilor Labs handles the Medicare as well as the commercial population that we have as member of our 37 million members. Labs are very interesting. There's various lab management systems that run the labs, and again, the ability to take and we'll talk about it in a little bit, to take an order in and send that to the laboratory, take some mapping, as well as paying that claim. So we'll spend a little time on that in a little bit. Again, all of this to service our member, make sure that we have the highest quality products and service offerings as we deliver both exams and materials to our members. So I mentioned before, in 2018, we set out for a transformation journey, really included and driven by business and business needs, and really the need to modernize our platforms, modernize the experience for our eye care professionals, for our members, and for all those that we serve. And one of the programs I wanted to highlight today, and really where we spend the majority of our time as far as our transformation program, was specifically to our eye care professional portal, as well as our laboratory, which included our laboratory model, a new laboratory model, which expanded our laboratory presence from 2 laboratories for the Davis business to over 76 laboratories across the country. And for the Superior business, really expanding into the laboratory space where before the clinicians serviced their own laboratory work through their partner labs. So really, we were changing our business model. We were enhancing it, and really the point of that was to drive value and savings for our members, for eye care professionals, and for Versant Health. And really, the end result really showed that we did that. Kind of the underlying message and goal that we had to set forth was operational excellence and making sure that we looked at how the industry worked, how the process flows worked, examined and pressure tested both internally and externally, using third parties, using focus groups, and really spending the time to walk through step by step the process and how it works and how do we improve the process. We spent a lot of time getting that feedback and we implemented most, if not all, of that feedback in what we produced in an end result. So we spent a lot of time, I mentioned, just plotting out and doing process mapping from a business standpoint. And really, when we talk about transformation and what we did digitally, really started with that experience and those business processes and those enhancements. So we spent a lot of time looking at how was going today, how our competitors' experience stacked up against that, and really try to eliminate some of the waste and some of the steps that didn't really make a lot of sense, and some of the controls that we had in place that were a little antiquated and didn't make a lot of sense. And again, this was a lot of change, and part of that change was not only internally managing through change management and operations and organizational management, but also change management amongst our constituents, and really that included including them as part of the journey that we took, but also following up with them throughout that journey, both through surveys, focus groups, as well as constant daily feedback from our call centers and other forums. So this really shows the journey that we took, an example of the journey that we took, looking at how the provider offices logged in, how they viewed a dashboard and made quick links to often used transactional processes on that dashboard to avoid click-throughs and multiple screens. We added a feature that sped up the search for members and allowed for multiple verification touch points. We also had key statistics for that member or for that provider office, and we had the ability to administer the whole security. We gave that to we empowered the office managers to have that ability to reset passwords, to restrict views, etc. So we were able to not only put some of that administrative work off of us, we gave that power to the hands of the office administrators, and really sped up termination of employees, as well as views and the ability to add people to their views. So really what this shows is that journey, along with the confirmations, details that eye care professionals in their offices needed in order to transact quickly, effectively, and accurately. So really, the journey led to the Underline technology. and the investments that we made. And this slide references the different touch points on the previous slide, but really the investments that we made, from a security standpoint, on number 2 there, with single sign-on, with the API gateways, and OAuth 2.0, new application. Really, prior to our release and the new GUI, it was kind of a flat experience and really a very transactional experience, in which what wasn't very conducive of productivity. So we spent a lot of time and invested in Angular and microservices, in order for the experience to be dynamic, using SPAs, single page applications, throughout that journey. Another feature, a lot of times people change their mind throughout the experience, or for example, someone in the office may get a call, somebody in the office might have somebody come to their desk. So we enabled auto-save features that weren't in place before, on our portal and our platform, in order for no lost work, for the folks that were entering data and information in. So really, great features that we added. Another key feature that we added, and this is a result of bringing multiple platforms together, administrative platforms together, was developing a member master data and provider data management systems, and really creating a one source of truth for the multiple systems. So again, a journey, getting to the point where we could bring disparate data together from our various platforms. Again, when we talk about provider data, we're talking about the provider themselves, the provider demographics, their addresses, where they perform their services, what services they offer, and bringing it all into one place, so that if a superior vision legacy member comes in, we'll have that information all in one place. The same experience if a Davis Vision member comes in, all the same experience, because it all comes from the same data source. Removing that connection directly to the core administrative systems and putting it into that layer. We also created, using a low-code platform, a benefits data mapping. So we could take the data that was in and the benefits that a member would have that were in our administrative platforms, and map it to what we wanted and how we want it displayed. So instead of using our language, we used member-facing, eye care professional-facing language, so that people could understand it, and it was fairly straightforward, and it was consistent. So again, that is something that we designed as part of our low-code platform that we integrated into our platforms. The next items, and I'm going to spend a little more time on this in a subsequent slide, but the complexity of this business, as I mentioned before, is not just on the transaction basis. It's also within what the offerings are. And part of that was the lens and frame offerings, as well as contact lenses that we offer to our members. And I'll save it for a little bit, but very complex process, and the ability to manage that in one place, and be able to map correspondent CPT codes, as well as HCPCS codes, as well as modifiers to those specific items, is critical in the success of our program. The APIs. So we spent a good amount of time developing APIs that that would connect or go through the API layer to our core administrative platforms, and mapping it from our front end to the back end platforms. We also originally implemented a hold time for the claims to be submitted, claims and orders to be submitted, just because, again, things change over time, and we have the ability to change that as well. So that is something that we added to our platforms. And then also what we added was the ability for, because we expanded our laboratory offerings, we offered the ability to register for new laboratories and set up accounts for those laboratories through the Essilor network, as well as our own lab. And I think that registration process is fairly complex and involves, authors looking up that member, making sure, or looking up that provider office, seeing that they already have an account with that laboratory, and then sending that information back. If they don't have an account, then adding that information in, API sent over to the laboratories systems, and then that information being added, and then response back. So a lot of complexity in that process as well. Finally, I mentioned before the hold time that we put on the laboratory, as well as the claim submissions, against a feature that we can turn on and off or modify the times being submitted, as well as member updates real time. But also an important feature that obviously, as consumers of products, as well as eye care professionals want to see, is where is my job? Where is my status of my laboratory order, as well as my claim? Is it done? Where in the process is it? When is it going to be shipped? And what is the shipping information? And that we also included in our portal. So taking this transformation journey and these investments, we really simplified and really gave the business and empowered the business in being part of the changes, and really developing a platform that allows for dynamic changes that happen all the time, that remove the reliance, our 100% reliance on IT, give the power to the users and the business users to make changes and have those safeguards, the security, the underlying security in place, as well as transact workflows that allowed us to really expand and grow our business. So on the left, I'm sure a lot of people have seen the spaghetti diagrams of systems and platforms, kind of a legacy way of thinking, and we moved to more of a kind of streamlined 3-tier architecture in the way we designed our platforms. I talked about before the complexity of the vision business on both a transaction basis and an offering basis. I just want to spend a little time here just digging deeper a little on that, and kind of how we came up with solutions and how we thought about solutions when we designed them. So one of the things that I mentioned before was the catalog, the lens catalog, lens and frame catalog. And when we talk about lenses, it's not as easy as just taking a hockey puck looking thing and just cutting them. They're very complex on what is offered in them. They are offered in multiple different materials. For example, you can get a plastic lens, you can get a polycarbonate lens. We also have lens materials called high index, and these are lenses that you can put very high prescriptions in that are very thin. We also have photochromic. You probably heard of transitions. These are lenses that change and sensitive to the light when you step outside. They'll tint. We have anti-reflective coatings. You can probably see my glasses have a purple hue in them. That's because I have blue light and anti-reflective lenses. And again, these are coatings that are put on the lens to protect my eyes against both reflection as well as blue light. And when we start talking about lenses, materials, additional coatings and offerings, we talk about different permutations. Not every lens offers every single added lens add-on. So they're not all available in different materials. So there's thousands and thousands of permutations of lens styles, lens offerings as far as materials and coatings and other things that you can add to lens. There's also the complexity of some lenses don't fit certain frames. If my prescription doesn't is very high, it might not fit a very thin reader type of glasses. So those complexities have to be managed. And one of the ways that we looked at managing those was through a no-code, low-code platform called Joget. Again, we looked at several low-code offerings such as Mendix and Pega, but we landed on Joget for several reasons. The flexibility, the ability to view your business process and quickly change the cost as well. And not to mention, Joget is a Maryland company, so always apt to supporting a Maryland company. They're located in Maryland, but however, they're an international company and have international clients. So a very good, offering that they have. The complexities as far as lenses just doesn't stop there, and part of our management of our lens catalog also goes beyond. And I mentioned before, when we submit a claim and when we pay a claim, we need what is called CPT codes, and in the vision space, we also have what is called HCPCS codes, and those HCPCS codes relate mostly to the materials that we're selecting. So each of the lenses and the lens types, whether it's a single vision lens or what I wear, a progressive, has a different HCPCS code. We also, just to make it a little more complex, there's also multiple layers of progressives. For example, I can get a basic progressive offering, or I can get all the way up to the ultimate progressives, which I wear. And really each insurance company has different formulary tiers. We have a 4-tier structure here at Versant Health. So these lenses have to be mapped to those tiers. They also have to be mapped to the appropriate HCPCS codes, as well as we use modifiers to identify which tiers that these lenses are part of. So we have to put in this lens, delineate what is allowed to be on this lens, and then we have to map them to CPT or HCPCS codes as well as modifiers. And as part of that process, that not only is handled within the supply chain, which I oversee as well, but is also handled within our claims and configuration departments. So the Joget platform that we set up also has a workflow feature in which once the new lens is mapped or is taken away from the catalog, a notification is sent over via email to our configuration department to set up the appropriate HCPCS as well as modifier combination within the tool. That then gets promoted. Once it's reviewed, there's an audit process. Once that's reviewed and added, that then goes over to our production system. So, really kind of an alternative way to think about it, and a way that gave the power to the users to do this. And really, this is something that we're really proud of. We've actually had discussions with Essilor, and that they're very intrigued by what we created, and as well as a company that we use called Vision Web. And Vision Web is kind of the intermediary between the laboratories, our laboratory network, and our portal. So we really use Vision Web to send this information over, and then it's kind of an intermediary, gets sent over to the appropriate laboratory once the information is reviewed on that as well. So that, again, is another layer that we have to manage, is that translation between our catalog and that middle layer, Vision Web. And again, that involves those discussions and that interaction and working with Vision Web to update our catalogs for that mapping. So that is one use case that we utilized that no code low code platform Joget to manage this process. There are other cases as well that we implemented as well. One is there's a feature on our portal that shows in certain cases, depending on the client or the offering, it may show some information on the portal. It may not, depending on that credentials of that member and that client. So we manage that all through our application that we created in Joget. And just something about kind of where the future lies with these platforms. Gartner came out with a study a few months ago looking at, by 2025, 70% of new applications developed by enterprises will use low code or no code technologies. Now, we talk about giving the ability for the end user and the business user to utilize or to modify these platforms, but it's not just that. It's in coordination with our IT partners and really working through how we do this best and how we set it up. And we have business analysts that have been trained on these platforms and have the ability to quickly go through the processes, show what it would look like within minutes instead of the traditional software development lifecycle. Just some more about kind of the changes and how low code really services the challenges that we have in our industry. Historically, there have been high costs associated with fundamental changes to software design as well as websites, middleware, et cetera. As part of larger companies, as Brian mentioned before, sometimes you're fighting over capital dollars and you're fighting over ways that you're fighting against kind of the bigger guys being specialty benefits, ancillary benefits. You're fighting against medical in some cases. The costs and the limited capital availability really limits what you can do and your acceleration into enhancing the digital transformation in the industry. It's time consuming, takes a lot of time and eats a lot of resources. There could be opportunity costs related to that. Lack of flexibility. In the past, development issues that run into legacy systems, legacy platforms, and not being able to make those changes because you're handcuffed by those platforms. And then the changing business environment, the rapidness of how the world is interacting and how we're changing. And I think no better case than what we've experienced over the last year. Now, you look at how low code can fix those problems, and the initial survey has really good results of about 92% stated that using a low code platform, they have overcome significantly or modestly overcome those challenges through the use of low code platform, and I think that is something that moving forward, more folks will start looking into. It's not easy. Why haven't more people do it? 70%, Forrester did a survey that said 70% of folks still have paper-based processes. Why in this day and age do we still have paper-based processes? Well, I think a couple things, and I think some things that companies and organizations need to look at and ways really that it can accelerate, and it accelerated within Versant Health. Really requires a business leadership and champion committed to driving change, and that was part of my role. I was stripped out of my daily duties and placed into a role that really was the champion and leader of these changes, and having that leader not outside of the IT organization, that it was really a business-driven initiative, and really those enhancements and change came from the business. It was not only change management, it was a journey to get through, throughout the organization, internally and externally. So there was a lot of, we call them roadshows, where we would go through and show what we were doing throughout the organization at each location prior to COVID. But also externally, we had to retrain our eye care professionals in ways that in processes they were used to for 25 plus years. So really, it was a extensive change management, which meant we had to over exaggerate those trainings. We set up a training hub open to the public on our portal that really had videos and training pamphlets, etc. Also involved organizational change. There were folks that just didn't want to get on that journey, and we needed to change our organization to get the skill sets needed in order to get to where we needed to be. Second to that business leadership is having clear business goals and needing to that need to be developed and committed throughout the organization. So really making sure that the alignment of those goals throughout the organization, which then eventually derives the solutioning of that transformation. Investment. There's both investment needed for leadership in understanding the digital transformation and the technologies that are out there and offerings. And really, there were some interesting studies in a recent MIT survey that showed that there was a big gap between the acknowledgement of the commitment and need for digital transformation and having the skill sets within the company to make that happen and to champion that. So there is investment needed within organizations to do so. Another success factor was the full value chain being funded end to end in order to realize the benefits. That easier said than done. However, in order to present and in order to display the results, the intended results, really needed that full funding, and it really needed a business plan as well as a full financial plan in order to get there and to get the commitment from our board of directors and our owners. There's really no cutting corners when it comes to this type of transformation. You have to look at the big picture and really fully fund that. Digital transformation can be achieved at any size company, so there should be no restrictions on the size of a company. It really could happen, from a startup to the largest companies in the world. And then finally, the COVID-19 pandemic has proven the need to be adaptive and quick, or you will be left behind. I think you heard yesterday some of the need and demand and the lessons we learned from COVID-19 and the ability to be adaptive and change how consumers are purchasing their services and goods. For example, when the world shut down last year for COVID, we still continued to have offerings online through some of our online retailers, which we integrated with through our programs, allowing benefits to be seen and used at those retailers. So really, thinking outside and not just being comfortable with where we are today, but really understanding and anticipating any of those changes that may occur in the future. So I'm going to pause there. Brian, I have kind of wrapped up my presentation portion of the presentations and open up to questions.
Yeah, thank you, Josh. I appreciate all your remarks. We will now open it up for questions, and as you know, you're well trained to do these things on Zoom now. You will find a chat and Q&A features at the bottom of your screen. If you have a question, please use one of those features. And Josh, we do have a question for you from to one of the attendees. So I'll just kick it off with that. How important was sort of or what role did the low-code platform play in your overall transformation strategy? And how did you choose which one to use?
Yeah, that's a great question. You know, I mentioned before kind of the complexities of our industry, and in order to manage those complexities, it was essential. I think we created at least 4 or 5 different applications from the low-code platform. So when we looked at our overall transformation, it played a critical piece. The ability for the claims to be paid, to be coded correctly, to be sent, orders to be sent on a timely basis, and for items to be translated in a way that could make that happen. What was fundamental and essential to our program. When looking at different platforms, everybody has slightly different criteria, but I think it was important for me when you look at a platform, the ability and flexibility is number one. I would say that also it's not good enough just to hand over the platform and say good luck. I think the ongoing service and support that is given by the various companies is important, and how much you pay for that support is very important as well. Again, I'd be remiss to not mention cost. And I think in a cost-effective, whether it's open source or more license-based and complexity of those, that is very important. So the fact too that the owners of the company are just one phone call away, and the ability to help support us was essential.
Josh, I have a few more questions that have come in, so I'll just take them in the order that they were received. One question is, can you speak to how internet bandwidth availability has impacted or had no impact on digital transformation efforts at your company?
That's a great question. I think we looked at performance. Performance was critical, and I think when as we built out our I can't say we didn't learn lessons throughout the journey. So we looked at those changes and the ability to implement those changes on various platforms and bandwidths, and think that, obviously a consideration as part of what we design and put to marketplace. I think obviously not the key consideration, but a consideration as part of our transformation.
This is a broad question. I think focus on the very beginning of it. So what were your biggest challenges when you started this transformation journey?
Yeah, I think a couple things. I mentioned change management, and really having that, me being in the seat of that business leader and champion, going through the organization and really showing the need and purpose for this transformation, and eliminating that thought of, well, this is how we've done it for 20 years, we've been successful, and really saying, well, that's not going to make us successful in the future. So really bringing them along for the journey was part of the challenge, but it was a great challenge. And I think also the eye care professional community, with the same kind of concept of, this is how we've done it for some time. This is not how your competition does it, and really overcoming those challenges. I think that was the biggest challenge, because it's a lot of time and a lot of energy that's devoted to it, but it's important time and energy, and that's why a business champion is needed in order for those type of programs to be successful.
Yeah, along the same vein, I think, is your answer here, is a question. What are the key skill sets a digital transformation change agent needs to succeed? So is it process expertise? Is it project management expertise? Is it something else?
It's a great question. All the above. No, that's the easy answer. No, I think a couple attributes, internally that I feel successful transformation agents have. I think flexibility. I think the innate ability to understand the business processes, to be able to flex up and down within an organization. There's times that I have to play BA in some cases. There's times that I'm presenting to our board of directors, but being able to adjust to the correct audience and being able to understand the content. I know enough to be dangerous as far as the technology behind it, but I don't have to be the expert. So I have I had those folks surrounding me, and being able to be surrounded by the expertise and the ability to rely on those folks to really make it a successful journey. But really it's having that aspiration to learn, to be flexible, and to be able to flex up and down the organization and externally.
Yeah, I don't see any other questions. I had a question. You mentioned Jogit was maybe not a Maryland-based company, but a company with a Maryland presence that was a vendor or partner of yours. Are you finding that I just have to know, as a Maryland Tech Council, are you finding that some of the other digital transformation related companies, or are you finding the vendors here in Maryland, or is it more of a nationwide industries? So
Yeah, it's a global industry now. Yeah, Joget is actually headquartered here in Columbia, Maryland, and has a presence throughout the world. So they have locations in Indonesia, United Arab Emirates, and other areas. Really, it's throughout the globe. Really, I pride myself on supporting Maryland businesses, especially in the technology space. And really, when I can drive over somewhere and see someone eye to eye and have those tough conversations, it's a great time. So for them, but I think the way the world is flat, and especially with the way we operate today, we're on Zoom. You can be anywhere in the world. And those organizations are throughout the world, and there's large companies, Microsoft, that are championing this, Oracle, and then there's smaller companies that for me are more nimble and more cost effective.
well, we certainly encourage everyone to work with their local partners when they can. So we have until 10 a.m. It's 9:53. I did get a couple more questions in. If it's okay, Josh, I'll ask you those.
Absolutely.
Chicken and egg wise, which came first? Were you tagged as the change champion and then got others internally on board? Or did the board or some other leadership at the company push this?
Yeah, it's a great question. I think being part of a private equity firm, there is a value creation plan that is created that really shows the end result. How do we get to these financial performances after 3-5 years? And how you get there is the journey that you take. And the chicken or egg, great question. I'd like to say that we were given the task of, and we discovered the projects that we wanted to develop, and then I feel that I was brought in and as part of that, opened my mind and my thinking process, and working with companies internally and externally to say what is the best way to get there. So really, I think it was I came first, and then the change came after me.
Okay. We'll have one last question here, and it may be your most difficult and challenging question,
Okay.
but maybe the most interesting as well. So looking back, Josh, what would you do differently?
Wow, that's great. Great question. I think a lot of times when you're going through that transition, and I mentioned, it's change management. And I think we talked about business and organizational changes that are needed. And in some cases, as we were going through the transformation, I think there were times where we saw processes or even individuals that were not adapting or changing, and in fact, kind of going against us. If I were to do it again, I think I would address those things a little quicker than we did. I think we lost some time, running into some roadblocks, both organizationally and process wise, operationally. And I think as lessons learned, I think it's important that you address things head on, you address things fast. You understand that there is a level of adaptation needed amongst all constituents, but there's an end of the line of that, and changes are needed as quick as the world is changing. Sometimes the organization needs to change quicker.
Okay, Josh, thank you so much. Thank you again for joining us this morning and providing a great keynote. We really appreciate your remarks and your time. I encourage all of you who are on to stick around for today's sessions, including a couple that I can't wait to attend this morning. Those include Erasing the Digital Divide and 5G and Emerging Technologies. The Erasing the Digital Divide will occur at 10:10 after a 10-minute break. We also have some great sessions in the afternoon that I urge you to participate in as well. So with that, thank you from the Maryland Tech Council, and I will join you for the next session.
Thank you, Brian. Thank you.